Last winter, the pressure on the health service led to desperate measures. Hospitals swamped with patients declared major incidents. This man was treated in a stockroom.
Do you get all this stuff in behind me? Yeah?
As waiting time targets fell by the wayside, one A&E unit erected a tent to cope with demand. Today, the terrible financial toll of this winter crisis has now been laid bare. At the end of 2013-14, health trusts were £115 million in the red. They knew 2014-15 would be tough and predicted there'd be a £417 million deficit by the end of the financial year. But the actual deficit is almost twice that, ballooning to £822 million. Trusts offering acute services are in the biggest trouble. 2/3 of hospitals across England are now in the red. Bart's Hospital Trust in London has the biggest black hole, an £80 million deficit. It's just had the quality of its care rated inadequate as well. The medical director told me without a major rethink of how healthcare is delivered, getting back into the black is nigh on impossible.
It's getting harder. We're getting to the stage now where just the standard way we think about saving, cutting cost isn't going to work. We have to think about transforming services. And if we're going to do that, it's not just as an individual organisation like Bart's Health, it is as a system.
The experts say the hard truth is staff cuts may be the only realistic option to rein in expenditure.
For hospitals, most of their money goes on staff, and so although you can save some money on procurement, I think they'll have to turn to first agency staff, the most expensive end. I think it's quite optimistic to hope that it would end there, and we would expect to see a reduction in staff across the NHS.
Hospitals under strain have gone into the red, spending their way out of difficulty to maintain safe staffing levels for their patients. But it's not a sustainable solution, and the alternatives are grim. Catherine Jones, 5 News.